Hello, Dr. Justin Misko, JMISKO Surgical Design. Had a few more little points we wanted to address when it comes to Botox. One, 14 days. We got to give it some time to set up. I think first and foremost, we have a lot of folks that call back in 5, 6, 7 days later saying my Botox is not setting up. Give it just a little bit of time. Let's take a look at it 2 weeks later. Let's see how well that Botox is working. Don't jump the gun. In the same regard, don't wait too long. I'd like to see you, if there is a little bit of movement and we need to add a couple of units of Botox to a certain area, I'd like to see you back at 14 days, or maybe it's 3 weeks or 4 weeks. That's a reasonable interval to follow up in office. Waiting 2.5 months and then letting us know that your Botox has not set up. Botox is only FDA approved the last 3 months. So really hard for us to assess the effectiveness of the treatment at too long of an interval as well. Dose dependency, I think, is also kind of going to get thrown right into the mix there. When we look at how long a product is going to last, it is dose dependent. So if we're treating extremely conservative, of course it's going to wear off a little bit sooner. If we're treating appropriately, hopefully it will last a little bit longer, but we do need to be using the right amount of Botox in those areas. We did a previous video where we talked about numbers of units in certain areas briefly. But again, if we treat a little bit more conservatively, you may plan on coming into the office and treating some small wrinkles. A lot of folks like a little bit of movement. They enjoy seeing a very natural look to their Botox treatment, and they don't want to be completely paralyzed, if you will. That's sometimes a little less than natural. So that problem can be addressed just by getting appropriate follow-up in our office. I think longevity when it comes to age is also important. I have a lot of millennials now coming into our office. I guess we're even talking just generally speaking about age. When there's a wrinkle at rest, when there is a wrinkle on your face, it's appropriate to treat that wrinkle with Botox. In the past, younger patients, that 20-year-old demographic, they thought they were too young for Botox. Well, now it's approved to be used prophylactically. It's approved to be used to prevent some of these wrinkles from forming. So if we're really expressionate, we're on Snapchat, we're on Instagram, and there's a lot of movements, there's some wrinkles that we don't like, well, yeah, we can certainly use it for some of those areas as well. We might not need to retreat quite as frequently, but using it prophylactically is a great idea. You might, however, at that age with a strong immune system, with, let's say we have a very active lifestyle, a very fast metabolism, we might burn through that Botox very quickly. So I guess just a warning that we give all of our young patients, this probably won't last you 3 months. It might not last you 8 weeks. To the older demographic, 70 plus, now that we have a more sedentary lifestyle in many of those individuals, it's a decreased immune system, perhaps. Maybe we're diabetic, or maybe hypertensive, or other comorbidities. There's issues that are going on there where we're going to chew up that Botox a little slower, possibly. And I've seen folks in the office 5 months out, and I think Botox is still having some positive benefit at that age. The downside of that age is sometimes folks come in and those wrinkles are so deep or so aggressive that really Botox might not be the best option. We really might need to make a switch over to a filler or something else. But those are kind of the big things we want to touch on. Just again, we have questions in our office about how long it's supposed to last, etc. I think the takeaway here, make sure you're calling our office if there are problems, if we need touch-ups, etc. Hopefully that helps.